Good morning, everyone. Today's topic is complication of fractures because shit happens. So be prepared. If you know the complication of fracture, you can get better prepared and you won't get shock when you face it in ER. Complications inevitably occur in a proportion of fractures. As death is certain after life, complications are certain after fracture. Some are slight, some are severe, and some are catastrophic. Catastrophic means lethal for life or limb. It can make the patient either disabled or can make working capacity loss. So be aware of the possibilities of complications, and prompt and proper management can avert most of the complications. Complications can be divided into general and local. Local complications can be early and late. तिमीहरूले एक्जाममा सोध्छ है कम्प्लिकेसन अफ फ्र्याक्चर सर्ट नोट भनेर त्यसमा लेख्ने बेलामा चाहिँ जनरल लोकल भनेर लेख्ने जनरल लोकल अर्ली एन्ड लेट डिवाइड गरेर लेख्ने General complications are shock. Shock can be hypovolemic shock or hemorrhagic shock, septic shock, pneumogenic shock, fat embolism, pulmonary embolism, cross syndrome, multiple organ failure, thromboembolism, tetanus, and gas gangrene. General complications means like systemic complications. Whole system involved in chai. Another is local complications. So only the limbs are involved in this. Early complications are visceral injury to the viscera like lungs, bladder, urethra, and rectum. Vascular injury to vessels, nerve injury, compartment syndrome, haemarthrosis. Haemarthrosis means blood in the joint. Infection, gas gangrene, fracture blisters, plaster and pressure sores. Late complications are delayed union, non-union, malunion, avascular necrosis, growth disturbance, bed sore, myositis ossificans. Myositis ossificans means ossificans means newborn formation. Myositis means in muscle. Newborn formation in muscle is myositis ossificans. Muscle contracture after prolonged immobilization. Tendon lesions can be there can be tendon injury or tendon rupture. Nerve compression and entrapment like carpal tunnel syndrome. Joint instability or stiffness. Complex regional pain syndrome त्यसलाई DYSTROPHY पनि भन्छ, and osteoarthritis. Shock is inadequate perfusion and oxygenation of tissues due to failure of circulatory system, which leads to hypoxia that may damage the vital organs. It occurs after fracture of long bones, pelvic fractures, multi-system injuries following road traffic accidents, burn surgeries, and dehydration. It is the most common cause of death following fracture. Most of the death usually occur during within 3 hours of the accidents, and most of these deaths are due to shock, due to hypovolemic shock, and this can be prevented if timely intervened. Clinical features of shock: this can be hypotension, tachycardia, oliguria, clouded sensorium, cool, clammy, moist skin, increased respiratory rate, low volume or rapid 3D pulse, sweating, sunken eyeballs, tongue is pale and dry, and patient gradually becomes drowsy, PP falls, and renal output decreases. Patient may become unconscious and die. The surgery medicine पढ्यो होला सक्को है. Orthopedic side बाट इम्पोर्टेन्ट भनेको चाहिँ कुन चाहिँ बोन फ्र्याक्चर हुँदाखेरि कति ब्लड लस हुन्छ त्यो इम्पोर्टेन्ट छ. यो फिगर चाहिँ इम्पोर्टेन्ट छ. जस्तो टिबिया फ्र्याक्चर भयो भने 1000 to 2000 ml जति ब्लड लस हुन्छ. फिमर फ्र्याक्चरमा 1500 to 2000 ml ब्लड लस हुन्छ. यसमा 1000 लेखेको छ, बट द्याट इज 1500 to 2000 ml. रेडियस अल्ना फ्र्याक्चर हुँदा 100 to 300 ml ब्लड लस हुन्छ. ह्युमेरस फ्र्याक्चर हुँदा 500 to 1000 ml. रिब केज फ्र्याक्चर हुँदाखेरि 1500 to 3000 ml क्यान लिड टु हेमोथोराक्स. अनि पेल्भिक बोन फ्र्याक्चर हुँदा मस्ट ब्लड लस चाहिँ पेल्भिक बोनबाट हुन्छ 1500 to 3000 ml. So in cases of RTA, when there are long bone fractures along with pelvic fractures, the patient is likely to die of shock. This is the classification of shock. तिमीहरु सर्जरीमा नि पढ्यो होला. Grade 1, 2, 3, 4 हुन्छ. Up to 750 ml or 15% blood loss, 15 to 30% blood loss, 30 to 40% blood loss, and more than 40% blood loss. Pulse rate, blood pressure हरु हेर्ने, and urine output is less than more than 30 ml in grade 1, 20 to 30 ml in grade 2, class 3 ma 10 to 20 ml, and less than 10 ml per hour in class 4. Treatment is by crystal white fluids in class grade 1 and 2, but you also need blood transfusion in grade 3 and 4. This is important, and you will also study in surgery. Your short note man socha, surgery man socha, ortho man socha. Management of shock, ABC means airway, breathing, circulation. The sabbaiमा हेर्नु पर्यो. Any patient that comes with fracture or shock, C for ABC. अनि position, head low, leg up. त्यो गरेपछि के हुन्छ, cerebral blood flow भनेको ब्रेनमा blood flow राम्रोसँग जान्छ and brain circulation will not be hampered. Fluid दिने, RL हरु दिनु पर्यो, NS दिनु पर्यो, अनि blood हरु चढाउनु पर्यो. Blood मा not only whole blood, also fresh frozen plasma, and monitor urine output. Drugs to increase BP like noradrenaline, adrenaline, and bleeding site हरुमा compression गर्ने र ligate गर्नु पर्छ. Identify the site of bleeding and ligate the arteries or veins. And fracture immobilization. If you immobilize the fracture, there will be less chances of bleeding and the less chances of going into shock. DIC, diffuse intravascular coagulopathy. It is the second most common cause of death following fractures. These are activated by tissue thromboplastin. Also, there are platelet activation due to endothelial injury can occur after massive blood transfusion. This can lead to multiple organ failure and death. So this is important. Management is by trying to stop the bleeding, compression, or compress the bleeding site, or ligate the arteries, bleeding arteries, fresh frozen plasma dine, platelet transfusion गर्ने, and heparin. Cross injury, the figure ma देख्यो तिमीहरुले, this is the case of RTA, road traffic accident. हात severely cross भएको छ र cross injury मा के हुन्छ, myoglobins हरु पनि involved हुन्छ र they go into the blood leading to urine leading to myoglobinuria, and there is acute renal failure. So the clinical features are edema. यता देखियो edema छ, पुरै सुन्निएको swelling हरु छ, hematoma, limb pulseless and red. Muscle power may be lost. Hypovolemia, there is severe blood loss, so that leads to hypovolemia. Hypotension is due to hypovolemia and tachycardia. Hypovolemia, hypotension, tachycardia सबै हुन्छ. Patient goes into anemia because there is blood loss. Compartment syndrome हुन्छ. Severe rise in compartment pressure. Electrolyte imbalance हुन्छ. There is hyperkalemia, hypocalcemia, metabolic acidosis, phosphorus and magnesium balance. Your red मा लेखेको चाहिँ तिमीहरुलाई so important छ है, MCQ मा सोध्छ र भाइभा मा पनि सोध्छ. जस्तो NMCLE मा, लोकसेवा इन्ट्रान्स हरुमा अथवा पिजी इन्ट्रान्स मा सोध्छ यो चाहिँ hyperkalemia, hypocalcemia and metabolic acidosis हुन्छ भनेर. Renal output decreases and low output uremia with acidosis develops. If renal function returns within 1 week, patient survives. So patient survival के हेर्ने indicator चाहिँ renal function हो. Cross injury मा most commonly involved organ is kidney. Acute kidney failure मा जान्छ patient. Management is monitor intake output हेर्नु पर्यो, urine output हरु के छ, so that gives a gross idea of the kidney function. Antibiotics हरु दिने to prevent infection, cover all gram positive, negative and anaerobic organisms, correct electrolytes and acidosis. Fluid हरु दिनु पर्यो, electrolytes हरु छुट्टै चढाउन नि मिल्छ, त्यो दिने. Dialysis गर्नुपर्ने हुन सक्छ. If patient goes into acute renal failure with high creatinine, urea, then we may need dialysis, and amputation may also be needed if the limb is severely crossed. So यो केसमा हेर severely crossed छ, road traffic accident, tibia fibula fracture छ, vessels हरु सबै injured भएको छ. So it also may need amputation. Amputation is not the failure of treatment, it is also a part of treatment भन्छ cross injury मा चाहिँ. DVT and pulmonary embolism, तिमीहरुले मेडिसिन मा नि पढ्यो होला. DVT means deep vein thrombosis. Birchall's triad थाहा छ नि हैन, blood formation in large veins leads to thrombus breaks up and leads to emboli, that leads to venous that leads to pulmonary embolism. Common sites are veins of the calf, thigh and pelvic veins. Most common sites of DVT are calf veins, but Most common causes of pulmonary embolism are thigh veins. यो सोध्छ है इम्पोर्टेन्ट छ भाइभामा एमसीक्यू इन्ट्रान्सहरुमा सोध्छ मोस्ट कमन साइट अफ DVT चाहिँ काख भेन हो तर काख भेन चाहिँ तल हुन्छ त त्यहाँबाट pulmonary embolism हुने चान्स कम हुन्छ रिस्क most common risk of pulmonary embolism is from thigh veins. Risk factors are elderly patients who are prolonged immobilized, underwent surgery, malignancies, hypercoagulable states, trauma, and cardiovascular diseases. So, ismaila deep veins. These are deep veins of the leg. These are normal vessels. In normal leg, there are valves that prevent the normal blood flow in upside. So, when there are clots, they accumulate here and they lead to thrombus. Any deep vein thrombosis that leads to limb is swollen, red, tender, and fever huncha. USC गर्नुपर्छ डक्टर USC of the veins गर्ने त्योबाट चाहिँ डायग्नोसिस हुन्छ म्यानेजमेन्ट लिम्ब एलिभेसन गर्नु पर्यो लिम्ब एलिभेसन भएपछि ब्लड फ्लो राम्रोसँग हुन्छ so there is not pooling of blood if the blood pools there peripheral pooling of blood भयो भने चाहिँ that can lead to DVT you know because there is because when blood accumulates there then there is high risk of thrombus formation ambulation गर्नु पर्यो ambulation पनि त्यही हो role that doesn't lead to blood accumulation calf muscle exercise same proper fitting castहरु लगाउने compressive stockings these are mechanical methods of prophylaxis अनि anticoagulants हरु दिने low molecular weight heparin हरु दिन्छ oxygen हरु दिने these are chemical prophylaxis so management of DVT are either physical or pharmacological physical are limb elevation ambulation calf muscle exercise proper fitting cast and compressive stockings these are physical methods pharmacological methods are anticoagulants low molecular weight heparin enoxaparin fondaxaparin हरु दिने जस्तै यो फिगरमा हेर्छ these are femoral vein great saphenous vein and popliteal vein veins from the legs they drain the blood to inferior vena cava ma when there is any thrombus any following DVT then that dislodges and becomes embolus goes to the lungs and in the lungs they can lead to pulmonary embolism this lung is intact normal and see this side there is a thrombus that had become embolism and that has led to pulmonary embolism respiratory difficulty huncha ani patient may need oxygen support or ventilator fat embolism as the name suggests fat globules from the marrow are pushed into the circulation that causes embolic phenomenon which is more common after fractures of the long bones ribs and pelvis triad of symptoms breathlessness confusion and petechiae these are petechial rashes सबै rashes हरु हो many chest हरुमा आउँछ neck मा आउँछ V shaped pattern मा हुन्छ है जस्तो हामीले vest हरु लगाउँछ नि vest लगाउँदाखेरि V shaped pattern हुन्छ त्यस्तै V shaped pattern मा चाहिँ rashes हरु देखिन्छ breathlessness हुन्छ patient is confused drowsy and petechial rashes these are the triad of symptoms to diagnose management prevent hypoxia oxygen dine ventilator support may be needed management is usually symptomatic जे छ symptom त्यसको मात्र ट्रिट गर्ने हो यसो आफ्नै ट्रिटमेन्ट छैन fat embolism को so give oxygen monitor PP urine output अनि fluid दिने electrolyte balance हरु मेन्टेन गर्ने heparin and steroids have limited role mainly symptomatic treatment with oxygen and fluid support these are the Gurds criteria to diagnose fat embolism major criteria minor criteria and there are lab features सम्झिनलाई सजिलो 1 + 4 + 1 at least 1 हुनुपर्छ major criteria minor criteria at least 4 and lab features at least 1 + 4 + 1 major criteria are respiratory insufficiency PaO2 partial pressure of oxygen less than 60 mm of Hg cerebral dysfunction भनेको confusion हुनु पर्यो र petechial rashes shortness of breath confusion petechial rashes these are the major criteria at least 1 should be present. Minor criteria: fever more than 38.5 degrees centigrade, tachycardia हुनु पर्यो, retinal changes हुनु पर्यो, fatty globules हुन्छ रेटिनामा, jaundice हुनु पर्यो र renal changes हुनु पर्यो. These are minor criteria. Lab features ma anemia, thrombocytopenia, decreased platelet count, high ESR, and fat macroglobulinemia. So 1 + 4 + 1 should be present to diagnose as fat embolism. Gas gangrene. Gas heading is the rapid and extensive necrosis of muscle accompanied by gas formation and systemic toxicity caused by Clostridium perfringens infection. This is a picture of gas gangrene, as you can see here. This is muscle necrosis. The subject gas formation muscle there are edema, sudden onset of pain localized to the infected area. This is the infected area. There is swelling, edema, pain, fever is may or may not be present. Profuse serous discharge with sweetish and mousy odor and gas formation are the hallmark of gas gangrene. So there is post formation, and this is most commonly caused especially in diabetic patients. The diabetic foot patient case. This is a case of gas gangrene of the forearm and arm. It's a muscle necrosis. Black. These blacks are all muscle necrosed muscles. Patient has undergone surgery, and these are all necrosed muscles. Muscles have all died. Management is surgical debridement. Early diagnosis should be done to prevent the death of patient. Mortality come host one early diagnosis and prompt treatment because gas gangrene has high mortality rate. IV antibiotics are hyperbaric oxygen and fluid replacement. Patient is dehydrated, so we should keep fluid replacement with electrolyte balance. Mainstay of treatment: early diagnosis and surgical debridement. Tetanus caused by Clostridium tetani. Timurle combat medicine mani padyo hola. This is a case of opisthotonus. This is a pictorial, and this is a real picture. Like here, tonic-clonic contraction, especially of the face, lower jaw, around the wound, neck, trunk, and finally spasm of the diaphragm and intercostal muscles leads to respiratory paralysis and death. Main cause of death is respiratory failure due to diaphragm paralysis and intercostal muscles paralysis. Management: prophylaxis garnu paryo, treatment, antitoxins, antibiotics, oxygen, isolation ma rakhnu parcha patient like, and because they are severely intolerant to light and sound, muscle relaxant dine to prevent paralysis of the diaphragm and intercostal muscles. Intubation garnu pani huna sakcha respiratory paralysis ma gayo bhane, ani prophylaxis गर्ने by tetanus toxoid injection. अब orthopedic आयो है. Local visceral injury. Fractures around the trunk are often complicated by injury to the adjacent viscera. So if there are pelvic fractures, that can lead to injury of the bladder, urethral rupture, and retroperitoneal hematoma. Refracture can lead to pneumothorax, hemothorax, injury to the liver and spleen. So these are multidisciplinary approach, should be treated by surgery as well as orthopedics. Vascular injury. Vascular injury means injury to the nerves, injury to the arteries and veins. Most commonly occur in knee, femur, shaft fracture, elbow, and humerus fracture. This is fracture of the leg, knee fracture, there are vessel injuries. These are associated with high energy trauma and open fractures, usually most common after open fractures. Artery may be cut, torn, compressed, or contused. Artery cut this can either be cut, compressed, or contused. Compression or contusion. Most common contusion vessel injury ma arteries are only cut and torn only in case of open fractures. Intima may be detached, thrombus or blocked by thrombus or arterial spasm due to trauma. Decreased blood flow and ischemia leads to tissue death and peripheral gangrene. Topic अलि भास्ट छ है, अलि कम्प्लिकेटेड, अलि गाह्रो छ, तर तिमीले पछि फेरि आउँछ अरु टपिकहरुमा नि, सो डोन्ट गेट कन्फ्युज्ड है, डोन्ट वरी. यो स्लाइड चाहिँ यो टेबल चाहिँ इम्पोर्टेन्ट छ है. कुन फ्र्याक्चर डिस्लोकेसनमा कुन आर्टरी इन्भल्भ हुन्छ तिमीहरुलाई थ्योरीमा एमसीक्यूहरुमा सबैमा सोध्छ, भाइभामा नि सोध्छ. फर्स्ट ट्रिप अर क्लाभिकल फ्र्याक्चर, सबक्लेविन आर्टरी इन्जुरी हुन्छ shoulder dislocation ma axillary artery, supracondylar humerus fracture ma brachial artery, elbow dislocation brachial artery, pelvic fracture ma presacral and internal iliac artery, supracondylar femur fracture ma femoral artery, knee dislocation ma popliteal artery, and proximal tibial fracture ma popliteal artery or branches. Yo chai important cha, screenshot haru लिए हुन्छ. Clinical features: patient with ischemia may have 5 P's. Your 5 P's पनि important छ है सोध्छ. Pain, paresthesia, pallor, pulselessness, and paralysis. Paralysis is the last feature. And don't wait for pulselessness to diagnose vessel injury. Pain, paresthesia, pallor बाट diagnosis गर्ने, pulselessness may or may not be present, and don't wait for paralysis. If vascular injury is suspected, do either angiogram or छैन भने go for Doppler. Management aim is to restore the blood flow. Emergency treatment हुनुपर्छ. All tight bandages and stents are removed. Circulation is reassessed after the next half hour. If no improvement, vessels explore गर्ने. And if there are torn, the vessels are torn, suture it or vein graft. If thrombosed, do endarterectomy. So in every cases of if patient present with shock or fractures in emergency department, always go for ABC. Airway, breathing, circulation. Circulation सबैमा check गर्ने. That can lead to either death or limb failure. Knob injury. There are variable degree of motor and sensory loss along the distribution of the knob. Radial knob is the most frequently damaged knob. Can be damaged by laceration, traction, pressure, or prolonged ischemia. So compression भयो अथवा shock मा गयो patient भने blood सबै राम्रोसँग हुँदैन, so that can lead to prolonged ischemia. 3 type को हुन्छ, neuropraxia, axonotmesis, and neurotemesis. Neuropraxia मा only physiological conduction block हुन्छ, axonहरु intact हुन्छ. Axonotmesis मा axon को पनि separation हुन्छ. र neurotemesis मा knob नै completely divided हुन्छ, दुई टुक्रा हुन्छ, knob नै cut हुन्छ, and spontaneous recovery is very unlikely. Management, wait and watch. If the knob function does not return, then we should go for exploration and repair. Knob injury मा तिमीले चाहिने एउटा चाहिँ radial knob most frequently injured हुन्छ, अरुको चाहिँ कुन टाइप छ, neuropraxia, axonotmesis, neurotemesis, 3 टाइप को हुन्छ, यो चाहिँ बुझ्नु पर्छ है. यो टेबल पनि इम्पोर्टेन्ट छ, यो लिने. Axillary knob is injured in case of dislocation of shoulder. Deltoid paralysis गराउँछ. Radial knob is injured in fracture shaft of humerus, especially distal third shaft of humerus छ भने चाहिँ radial knob injury हुन्छ. हाम्रोमा टन्नै पेशेन्टहरु आइराखेको हुन्छ. So you should know which knob is damaged in case of which trauma, and you should always examine the knob before operation or admission of the patient. Medical legal issue हुन सक्छ. पहिला knob ठीक थियो, पछि अपरेसन गर्दाखेरि अथवा हस्पिटल बस्दाखेरि डाक्टरले बिगार्दियो भनेर medical legal issue हुन सक्छ. So you should always examine the knobs. Ani supracondylar fracture of the humerus ma all knobs can be injured. Enterointerosseous knob, radial knob, median knob, and ulnar knob. Enterointerosseous knob is the most common. AIN is the most common knob to be injured in supracondylar humerus fracture. बच्चाहरुमा common हुन्छ. त्यसपछिको most frequent भनेको radial knob. Ani medial epicondylar fracture humerus ma ulnar knob injured हुन्छ. Posterior dislocation of the hip, sciatic knob is injured. And in case of knee dislocation or fracture neck of the fibula, common peroneal knob is injured because common peroneal knob winds up around the neck of the fibula. Fibula को neck यस्तो भयो भने यसरी घुमेर आउँछ common peroneal knob. त्यही भएर in case of fracture neck of the femur, fibula, there are high risks of common peroneal knob injury. अब यो effect चाहिँ हेर axillary knob injured भयो भने deltoid paralysis, wrist drop हुन्छ in case of radial knob, ulnar knob claw hand, and sciatic knob भयो भने foot drop हुन्छ. पछि तिमीहरुको त्यो knob injury पढाउने बेलामा छुट्टै आउँछ फेरि यो है. यो टेबल चाहिँ याद गर्ने. Compartment syndrome. आजको स्लाइडमा most important topic चाहिँ यही हो है, compartment syndrome. Compartment means a confined space, closed space like compartment भन्छ. जस्तो fascia separates groups of muscles in the arms and legs from each other. Inside each layer of fascia is a confined space called a compartment that includes the muscle tissues, nerves, bones, and blood vessels. So what happens when in a closed space or compartment, when the pressure rises, nerves and muscles are compressed. So the rise in pressure jeopardize the blood supply of the muscles and nerves within the compartment. त्यसले गर्दाखेरि के हुन्छ, nerves र muscleहरुको function cease हुन्छ, blood supply कम हुन्छ, ischemia मा जान्छ, and they die. So definition: elevation of interstitial pressure in a closed osteophyseal compartment leading to microvascular compromise. That's a definition. Compartment syndrome is a vicious circle that ends after 12 hours or less. Necrosis of the nerve and muscles within the compartment. Muscles and nerves duita necrosis huncha, but nerves are capable to regenerate, so they can come off again. But when muscles are infected, they never recover, replaced by inelastic fibrous tissues, or then that is called Volkmann's ischemic contracture. You have देखियो Volkmann's ischemic contracture भएको छ. पहिला compartment syndrome भयो, that was undiagnosed or untreated. Then muscles were infected and died, replaced by fibrous tissue. So there is contracture and the limb is not functioning. What are the causes? Any injury or infection leading to edema of muscle, fracture hematoma within the compartment, ischemia to the compartment leading to muscle edema, or due to tight bandage and cast. Hallmark symptoms say pain out of proportion to injury that does not respond to elevation or pain medication. यो चाहिँ diagnostic हो है compartment syndrome को. Pain out of proportion to injury. जति चोट लागेको छ त्यो भन्दा बढी दुख्छ र मेडिकेसनहरु दिएर अथवा हातमाथि यसरी झुन्डाएर एलिभेट गरेर पनि ठीक हुँदैन. अनि फिजिकल एक्जामिनेसन गर्दाखेरि चाहिँ पेन अन प्यासिभ स्ट्रेचिङ, जस्तो यो हात भयो यतापटि कम्पार्टमेन्ट सिन्ड्रोम छ भने पेन अन प्यासिभ स्ट्रेचिङ, यसरी स्ट्रेच गर्दाखेरि चाहिँ यता तन्कियो र त्यसमा चाहिँ पेन बढी हुन्छ. Pain in passive stretching out of proportion to injury. High risk injuries are fractures of the proximal third of the tibia. Most commonly occurs after fracture of the tibia, elbow, forearm, multiple fractures of hand and foot, cross injuries, and circumferential bonds. Whole limb involved भयो bondबाट भने चाहिँ whole circumference involved भयो भने that can lead to compartment syndrome. यो चाहिँदैन, यो भयो. Early prevention is limb elevation. Diagnosis is the measurement of the intercompartmental pressure. Treatment is fasciotomy. यसमा हेर यो this is normal limb and this has gone into compartment syndrome. And so treatment is by fasciotomy. Do it as early as possible. यो fasciotomy को picture हो. Haemarthrosis means accumulation of blood within the joints. This is normal joint, this is haemarthrosis joint. Management is by blood aspiration. Infection are most common after open fractures or can be iatrogenic. One becomes inflamed and starts bleeding pus. It can be superficial or moderate or severe. So management is by antibiotics and debridement. Antibiotics are surgical debridement करने. Delayed union means union will occur, but it will take prolonged time. Just the upper limb 4 to 6 weeks with union हुनुपर्छ, lower limbs 8 to 12 weeks union हुनुपर्छ. If it takes more than this time, then that is delayed union. This is the case of delayed union. Delayed union, non-unionहरुको छुट्टै क्लास हुन्छ है तिमीहरुको. How to diagnose? Clinical feature: persistent pain on walking or moving the limb. Patient fracture fix गरेको छौं हामीले, तै पनि अझै पेन भइराखेको छ. हात खुट्टा चलाउँदाखेरि अथवा हिड्दाखेरि छुँदाखेरि पनि टेन्डर छ, persistent tenderness छ भने that is delayed union. Extrema fracture line is still visible, no adequate callus or periosteal reaction, and fracture ends are not yet sclerosed or atrophic. यसमा हेर यो साइडमा चाहिँ lateral साइडमा fracture line visible छैन and callus मजासँग देखिएको छ. Medial साइडमा चाहिँ fracture line अझै देखिएको छ, visible र callus पनि छैन. It has gone into normal union, but this is delayed union in this. And fibula मा पनि this is fibula fracture line is still visible, no callus. So this is delayed union. यो केसमा युनियन राम्रो भइराखेको छ lateral साइडमा, medial tibia and fibula fracture मा चाहिँ delayed union छ. Treatment eliminate the cause, and operation गर्ने internal fixation and bone graft. Non-union means union has stopped, complete suspension of process of the healing. As a definition, established when a minimum of 9 months has elapsed since injury and fracture shows no signs of healing for the last 3 months. This is a case of non-union. Pseudoarthrosis means false joint. यहाँनिर non-union भएको छ र false joint बनेको छ. यो अर्को टपिकमा पढ्छौ. These are the pictures of non-union. Non-union picture हेर, क्यालस छैन, bone is atrophic भएर यसको डायमिटर हेर, स्क्लेरोज छ यता पुरै सेतो छ, डेन्स भएको छ. So sites of non-union are fractured neck of femur, talus, scaphoid, fifth metatarsal bone, and tibia. Most frequent site because of frequency of severe open tibial fractures. कुन साइटमा हुन्छ यो चाहिँ इम्पोर्टेन्ट छ है. दुईटा टाइप हुन्छ, हाइपरट्रोफिक non-union and atrophic non-union. ट्रिटमेन्टहरु यसमा पनि अपरेसन गर्ने अनि bone graft गर्ने. Internal fixation and bone graft. Malunion means a union in non-anatomical position or unacceptable position. This is malunion. Fractures united with angulation, rotation, loss of end-to-end opposition or overlap and shortening is malunion. Cancellous bone ma huncha usually. यसमा हेर femur fracture AP view मा कति राम्रो देखिया छ, ट्याक्कै unite भएको जस्तो देखिया छ, but in lateral view there is malunited. This is proximal fragment anteriorly छ, distal fragment चाहिँ posteriorly गएर unite भएको छ, बाङ्गो छुटेको छ. Avascular necrosis means death of the bone due to any other causes except vascular. Just visceral avascular necrosis ma gayo bhane, which are the most common sites, head of the femur. Necrosis means death of the bone tissue. See this femur, the normal femoral head kati ramro golo cha dekheko cha, and see here the femoral head is deformed. This is avascular necrosis. It is sclerosed and dense, and it is flat here. Head of the femur is the most common site of avascular necrosis. Proximal part of scaphoid, body of talus, and lunate. Patient will complain of pain and limping. Treatment is symptomatic treatment or arthroplasty, arthrodesis. तिमीलाई चाहिदैन, जस अपरेटिभ म्यानेजमेन्ट चाहिन्छ, आर्थोप्लास्टी गर्नुपर्ने हुन सक्छ, रिप्लेसमेन्ट गर्नुपर्ने हुन्छ. Osteoarthritis due to damage to articular cartilage, trauma, post-traumatic osteoarthritis पनि हुन सक्छ अथवा ओल्ड एजमा पनि हुन सक्छ. Joint stiffness due to prolonged immobilization or haemarthrosis. Prolonged immobilization भयो, हात खुट्टा नचलाइकन राख्यो भने स्टिफ हुन्छ जोइन्ट. फिंगर्सहरुमा elbow, knee, shoulder, hipहरु सबै. Treatment is physiotherapy and prevention is early mobilization. Reflex sympathetic dystrophy. Reflex sympathetic dystrophy are characterized by pain, swelling, stiffness, discoloration, and hyperhidrosis, osteoporosis, and trophic changes which are out of proportion to the inciting event. Usually occur after fracture, trauma, surgery, peripheral nerve injury, stroke पछि हुन्छ. Usually occur after fracture. See, this is normal limb, and this limb has gone into reflex sympathetic dystrophy. Mostly post-trauma and post-surgery due to nerve end injuries. There is swelling, stiffness, the limb is discoloration and hyperhidrotic. Ani X-ray feature ma, this is normal extremity and this is affected one. See, pure bone or osteoporotic size ma, carpal bone or keep and the keko sign, and the distal radius ko pani halka osteoporotic sa. Myositis ossificans. Myositis ossificans means new bone formation within the muscles. This is the elbow joint. There is new bone formation within the elbow joint. This is triceps muscle. Triceps muscle ma new bone formation bhaera baseko cha. Reactive lesion occurring in the soft tissues and sometimes in periosteum, which is characterized by fibrous and cartilaginous proliferation and by metaplastic changes. Muscles commonly involved are brachialis, quadratus femoris, adductor muscles of the thigh. Bad queen. नै यो चाहिँ निमोनिक्स भयो भने तिमीलाई एक्जाममा सोध्छ यो कुन कुन मसलमा मायोसाइटिस ओसिफिकेन्स हुन्छ भनेर. ब्याड क्वीन बी फर ब्राकियालिस, एडी भनेको एडक्टर मसल्स र क्वीन क्यू भनेको क्वाड्रेटस फिमोरिस. ट्रिटमेन्ट इज फिजियोथेरापी, अभोइड मसाज. मसाज चाहिँ त्यही भएर पोस्ट ट्रमाको हिस्ट्री छ भने चाहिँ मसाज गर्न नलाउने पेसेन्टहरुलाई. गाउँघरतिर तेल मालिस मस्त गर्छन्, त्यसले गर्दाखेरि that can lead to myositis ossificans. Indomethacin दिनुपर्छ 50 mg daily. Indomethacin has protective role against myositis ossificans. Radiotherapy दिन सकिन्छ अनि एक्सिजन गर्ने एक्सरसाइज गरेर यो जुन न्युबोर्न फर्मेसन छ त्यसलाई चाहिँ हटाउने. Thank you. Any questions? टपिक भास्ट छ है. अब त्यसमा एउटै स्लाइडमा आज धेरै क्लास टपिकहरू भयो, बट डोन्ट वरी, अरू जस्तो अरू टपिकहरू अरू फ्र्याक्चरहरूमा पनि फेरि आउँछ यो. अनि आज तिमीहरूले बुझ्नुपर्ने चाहिँ के कम्प्लिकेसन हुन्छ र अनि कम्पार्टमेन्ट सिन्ड्रोम मात्रै, नर्भ इन्जुरी, भेसल इन्जुरी कुन कुनमा हुन्छ त्यति बुझ्ने. कम्पार्टमेन्ट सिन्ड्रोम चाहिँ इम्पोर्टेन्ट छ, एक्जाममा सर्ट नोटहरूमा सोध्छ. लास्ट इयरतिर सोधेको थियो सायद. कम्पार्टमेन्ट सिन्ड्रोम चाहिँ इम्पोर्टेन्ट छ. दिस इज डेफिनेसन, यो याद गर्नु पर्यो. कम्पार्टमेन्ट सिन्ड्रोम भनेको के हो बुझ्ने. अनि कजेस, हलमार्क सिम्पटम, पेन आउट अफ प्रोपोर्सन टु इन्जुरी that does not respond to elevation or pain medication. यो पुरै लेख्नुपर्छ है. पेन आउट अफ प्रोपोर्सन टु इन्जुरी मात्रै लेखेर हुँदैन, पुरै लेख्ने. अनि पेन अन प्यासिभ स्ट्रेचिङ हुन्छ, जस्तो प्यासिभ स्ट्रेच गर्दाखेरि पेन हुन्छ त्यो पनि लेख्नुपर्छ. हाई रिस्क इन्जुरी के हो त्यो लेख्ने. त्यो एउटा साइकल बनाइदिनुपर्छ. अनि यो चाहिँ त्यसको नेचुरल हिस्ट्री हो. के हुन्छ कम्पार्टमेन्ट सिन्ड्रोम भएपछि त्यसको नेचुरल हिस्ट्री चाहिँ यो भयो, त्यो लेख्ने. भोल्कम्यान्स इस्केमिक कन्ट्र्याक्चर हुन्छ. अनि प्रिभेन्सन कसरी गर्ने, डायग्नोसिस, ट्रिटमेन्ट इज फेसियोटोमी. अर्ली फेसियोटोमी गर्नुपर्छ सस्पेक्ट गर्ने बित्तिकै. त्यही हो. हाउ टु प्रिभेन्ट ह्यापनिङ अफ भोल्कम्यान्स इस्केमिक कन्ट्र्याक्चर. भोल्कम्यान्स इस्केमिक कन्ट्र्याक्चर प्रिभेन्ट गर्नको लागि यु सुड always go for fasciotomy. If you suspect compartment syndrome, go for fasciotomy. Don't wait for 5Ps. 5Ps sign compartment syndrome देखिन्छ. Any case with basal injury, nerve injury, 5Ps देखि basal injury भयो भने 5P देखिन्छ. स्लाइड चाहिँ यसमा दिनुपर्छ. ओके. Myositis ossificans को cause after trauma and massage, bleeding हुन्छ. There is bleeding into the muscle that can lead to myositis ossificans. Most common inside